have been concerns about how effectively can we manage your symptoms and minimize side effects. Families are concerned. They are aware from talking to other people that certainly if shortness of breath and pain are symptoms, some of the medications we use have side effects that can cause the patient to be tired, lethargic, sleeping more. And they're sometimes reluctant to sort of put their toe in the water to try those to minimize their symptoms because they're afraid that the side effects may be greater than the benefit. So I think as palliative docs and hospice physicians, we really have come a long way. We've really been able to utilize these medicines and tailor them many times because of some of the diversities of types of medications that we have in our toolbox to be able to work with patients so that we get the benefits of the medicine with the least amount of side effects. I think I talk to patients always about this idea of trade-offs. So there clearly are trade-offs with any medication that we take. Those trade-offs can be significant, but they can certainly be minimized if they are used in the way that we've been trained to use them, taking into consideration that not all medications will work the same way for every patient. And so we really work very closely with the patient and the family to meet them where they are. What are your fears about trying this particular medication, and how might we put both of our big toes in the water slowly so that you can see the benefit and not be scared away that there really wasn't the big negative side effect that I was thinking we were going to see. Nowadays, the treatment of pain in the United States has really gotten to a point of being extremely effective. The types of medications and the routes of administrations that we available to us really allow us to be very creative with tailoring the needs of the patient's symptoms, particularly pain or shortness of breath, and minimizing those side effects. There are those patients that even with our best efforts ultimately end up not being as effectively managed at home, and some of those patients may at some point end up in a situation where they're admitted to what's called general inpatient hospice. Those are situations, fortunately they are few. The numbers of times that we have to utilize that, I think, because of the multiple tools we have in our toolbox has declined, but certainly there are those patients that do need that extra effort. We've maximized what we have available at home, and so they've not given the patient the full level of pain benefit that they're looking for, and many times we'll then at least discuss the idea of admitting them to general inpatient hospice. That's done in the hospital. The goal there really is to more effectively manage their pain or other symptoms that are being poorly controlled at home, with the idea that the goal would be to, once stabilized, bring them back to their home.
Occasionally, families are put in situations where they see their loved ones suffering near the end of life with a severe illness, and they feel helpless. And that's because I think physicians have set up a situation where they're sometimes paternalistic and they're the boss and you should listen to the physician. And they don't feel, the family doesn't feel empowered to be an equal part in that conversation on end-of-life treatment. I think they should feel empowered. I think they should pull the physician aside, try to have that conversation about priorities that their loved one may have that the physician has not seen. They should, if their loved one is alert and able to talk, they should have the physician listen more to the patient. And hopefully by that type of communication, the physician will listen and attend to some of these issues that the family feels are not being dealt with. Ultimately, though, if the family is unhappy with the treatment a physician is rendering, they do have the right to actually move on to a different physician for care. Certainly if hospice is desired and the physician isn't using hospice, they can ask for hospice, they can ask for palliative care. So they do have a lot of resources, I think, that they may not realize they have.